Health Awareness Month, and chances are you or someone you know is dealing with a mental illness. For parents and other systems of support, there isn't necessarily a straightforward guidebook for helping affected people, but taking it one step at a time is always a good start. Here to help us understand some of those important notes is Debra Belaga with NAMI in Marin County. And welcome, Debra. First off, mental health impacts 1 in 5 people. Most of them are young adults. So what can parents or guardians do to understand what their kids or anyone who is dealing with a mental illness are going through?
Well, thank you very much for having me. It is Mental Health Month, and I'm delighted that you're shining a light on this really important topic. The statistics are really overwhelming. 1 in 5 adults, as you said, experiences a mental health condition in any given year, and 1 in 25 serious mental illness, schizophrenia, psychosis, bipolar, major depression. And you're quite right. There are a number of resources for the individual who is going through a mental health challenge. But there's been a huge gap in terms of support for families. And the reason that's so important is that as a result of deinstitutionalization several decades ago, most of the caregiving has fallen on families. And it can be a very devastating situation. It's emotionally traumatic, it's financially difficult, it really can upend your life. And as you said, there is no guidebook to what to do, and most families, when confronted with this, really don't have any experience or any frame of reference. So in late 1970s, in response to this pressing need, the National Alliance on Mental Illness was created. And it has grown to be the largest grassroots organization dedicated to helping those impacted by mental illness. And what that means is not just dealing with the individual, but the families who are so deeply, deeply impacted. Families are important because they are caregivers. There are more than 8 million caregivers in this country who are dealing with an adult child with mental illness. The numbers are staggering. In addition, what the studies tell us is that family involvement is not just a necessity, but it also can really help with the recovery or the improvement in the situation. So NAMI National is based in Arlington, Virginia. It focuses on advocacy in Washington, but it operates through more than 650 affiliates. NAMI Marin is one of them. They operate at the state level, so there's a NAMI California and a NAMI Marin. If you happen to live in Alameda, there's a NAMI Alameda, San Francisco, Contra Costa. And what makes NAMI so unique is that the primary focus is on the families. Obviously, the individual with the condition is part of the family, but it focuses on those who are impacted. And we do that in a number of ways to provide help. We provide education because this is uncharted territory for most people. So we have a number of programs ranging from expert speakers who come in and talk about what the latest medicine is, what the treatments are. We have support groups, drop-in support groups for family members who can come and talk to others who are experiencing the same situation. NAMI Marin, like so many NAMIs, started off all volunteer. We happen to have some professional staff now because we've grown, but most of the programs are led by family members who can lend a compassionate ear as well as expertise to people. So every NAMI has different programs. I'll just use ours as a little microcosm. We have drop-in support groups in both Spanish and English. We have 8-week, very, very rigorous programs to help families. They double as a support group, but also informational. We have a helpline, which is usually a starting place. And what we try to do is connect people with the resources, the local resources. We like to pride ourselves in knowing more about the resources than anybody else. So if you pick up the phone and say, oh my goodness, I'm going through a crisis, we know how to walk people through it.
And Debra, it seems like there's so many good resources for people to have, especially families that are going through this. That number you said at the beginning, 1 in 5 people are experiencing mental illness. So it's great to know that NAMI is there as a great support system for families here in the Bay Area. We appreciate all your info and getting that out to our families here impacted by this. Thank you so much.